How many attendees?
50.
Wow.
Hi, everyone. Welcome in. We're going to get started in a few minutes here. Just let the bulk of our attendees sign on. Okay. We can give folks a chance a couple more seconds to sign on and we'll get started here. Good morning, everyone. All righty. Good morning and welcome to the applicant webinar info session for Aging Well Navigators and Gap Filling Services through the Senior Services Division at the Department of Family and Support Services. My name is Tabia, and I'm one of your hosts today. Just to get started with some housekeeping things, because of the volume of participants on this webinar, everybody is going to be muted throughout the duration. But we really encourage you to filter any questions you have through the Q&A function, and we'll answer those throughout. And we'll likely stop at a midpoint to answer questions and also at the end. The webinar is being recorded for your benefit, and we will post that on both the website, DFSS, and also our YouTube channel for you to reference, hopefully no more than a couple days after this meet time. The agenda for today is, we're going to get started on introductions, and then get into the purposes of the RFP, the background, and go over some of the selection criteria, just so you understand the ask for this particular request for proposal. And then we'll discuss timeline, and then I'll come back on at the end to give you some technical assistance to, move through iSupplier and e-procurement. Alrighty, with that, I will introduce myself. My name is Tavia David. I am the Executive Administrative Assistant for the Office of the First Deputy here at Family and Support Services. And I will hand it over to Victoria and Karen.
Good morning, everyone. My name is Karen Cobb. I'm delighted to have you all here this morning with us to talk about our Aging Well Navigators RFP. We've been working on this RFP for quite a while now, and we're delighted to actually get it out and see the volume of interest in this particular approach. Again, my name is Karen Cobb. I'm manager of senior services. I would like to introduce my colleague, Dr. Victoria Russo, who is a supervisor in senior services, who oversees a lot of our Alzheimer's disease prevention, innovation, and other supports throughout the department and division. Victoria, did I miss anything?
I think you got it.
Okay. So Victoria and I will be talking about this program at the beginning, and then of course Tavi will go ahead and speak about the specifics of actually the RFP. So again, thank you for coming today. Recall that senior services is housed within the Department of Family and Support Services, and really we are a lifespan department here at the City of Chicago. And to that end, we work with our community partners to connect Chicago residents and families to resources that build their stability, support their well-being, and empower them to thrive. Now, you can see here also our priorities are to deliver and support high-quality, innovative, and comprehensive services, collaborate with community partners, our sister agencies, and public officials on programs and policies to improve Chicagoans' lives and advance systemic change, to inform the public of resources that are available to them through DFSS and its community partners, and certainly to always steward DFSS resources responsibly and effectively. Next slide. We are one of 7 divisions within the Department of Family and Support Services, and as I mentioned, we are a lifespan department. We start at Children's Services with Head Start, early Head Start, and you may be familiar also with our youth services, One Summer Chicago, and our youth employment and youth engagement programs all throughout the city. We also have 6 different community service centers throughout the city of Chicago that are targeted towards Chicagoans of all ages. However, in general, it's folks who are kind of 60 and below. We have at those centers opportunities for case management, referrals to other services throughout the city and beyond city services, and also public benefits assistance. We have the Division on Gender-Based Violence, or it used to be called the Division on Domestic Violence. And that, of course, is to support individuals who are at risk of and have experienced or are currently experiencing any type of violence in their lives, and supporting them to do well and get out of those situations. Additionally, we have our homeless services, which provides support to individuals who are experiencing housing insecurity, those who are homeless, and also this division is helping with our tremendous new arrivals program, which has had over 20,000 new arrivals in the city of Chicago since last year. We also have our workforce services that works with Chicagoans of all ages to help them to find employment, prepare for employment, helps them to train. And there is actually a strong emphasis in that program on those experiencing re-entry or are returning Chicagoans. And finally, small but mighty, our senior services, and we offer supports and programs to older adults aged 60 and better. In general, some of our programs are for individuals age 55 and better in all of the areas that you see in the yellow box. And of course, highlighted by our 21 senior centers. And we work with delegate agencies and really touch and improve a lot of lives. Next slide, please. We are, of course, an area agency on aging, one of Illinois' 13 area agencies on aging. The area agencies on aging receive money from the federal government via the Illinois Department on Aging to provide regionally relevant and appropriate services to engage and support all older Illinoisans over age 60. We, of course, serve the area within the city of Chicago proper. We're about one of about 7 or 8 sister cities. You can think of New York City, Atlanta, Houston, Los Angeles, San Francisco, Seattle, where the city infrastructure has the AAA embedded in it to leverage the other supports within city services. To that end, we advocate, plan, and coordinate fund services for older adults. And although we serve all older adults, our emphasis is always on those with the greatest economic need, those live alone, and those who are at risk of institutional placement. Our goals as a AAA, you can see below, we want to support independent living for as long as possible. And this RFP plays a really important role in that. We want to ensure that those who reside in institutions are treated with dignity and care. And we want to guarantee that older adults have access to accurate information to participate in public policy. Next slide, please. We serve as a access point for older Chicagoans and their caregivers through 311, where we have senior well-being checks and senior services information. Certainly through our information and assistance program that serves as a gateway to information, referrals, assessment, and services to older adults. And then finally, we also have our state serve as access point to our state CCUs and community care programs. Next slide, please. To that end, we offer a range of services to provide supports to older adults. As stated, we have 6 regional senior centers and 21 satellite senior centers throughout the city. Our information and assistance, or INA, provides support accessing all services to older adults, in addition to benefits assistance with Medicare, enrollment assistance and savings, license plate discounts, so state-funded programs, including seniors ride-free bus pass and reduced fare, as well as helping people in general to navigate the often complex world of support for older adults. We also provide services in-home and support services, which is where this program falls under, including home-delivered meals, our short-term and heavy-duty chore programs, our caregiver programs, and programs for grandparents and other relatives raising grandchildren, our senior well-being checks and intensive case advocacy support, and then our other elder rights programs, including legal services and adult protective services, and its companion, the Ombudsman program, for those residing in residential settings throughout the city. Finally, we have an emphasis on programs to engage people, especially with a focus on older adults, and to address social isolation. These include our foster grandparent and senior companion volunteer programs. We offer a range of evidence-based programs to support caregivers and have our apartment manager training. Next slide, please.
Thank you, Karen.
You're
Really
welcome.
appreciate it. Now that Karen covered the basics of what we do here at Senior Services Division, let's get a little bit more specific about this RFP and the purpose of the RFP. The Aging Well Navigator and Gap Filling RFP seeks proposals from qualified organizations who have experience providing benefits and social service resources, gap filling services, or other relevant supports to adults 60 years of age or older. the Chicago Department of Family and Support Services Senior Service Division seeks to provide the Aging Well Navigator services through contracted agencies in 4 regions across the city. Interested agencies will identify resources and service needs for clients 60 years of age or older independently in selected apartment buildings. Additionally, agencies will provide gap filling assistance to seniors experiencing a crisis with an immediate need for financial support. Next slide. This diagram here gives you a sense of where the 4 regions will be. Okay, so it's just a visual. Next. All right. To give you a background on why we're doing this, as you know, Chicago will grow from approximately 484,333 in 2020 to nearly 558,340 in 2025. The data trends with the older adult population reveal that more and more seniors will live alone and struggle economically as they seek to age in place within their homes and communities. In 2021, 80,613 of the total senior population in Chicago had incomes below the poverty level, which was an increase of 34% from 2010. Currently, the annual median income for Chicago households headed by a senior is $38,118. By comparison, the overall median household income in Chicago is $65,781. Thus, some seniors are confronted with difficult lifestyle choices as they grapple with limited financial resources as the cost of living within the city and the costs associated with aging constantly rise. Next slide. So our goals with the Aging Well Navigator program is to address the diverse needs of older adults by meeting them where they live and bringing informational and resources and material to them as they seek to age well and with dignity. Our goal is to support senior well-being by connecting seniors to resources, benefits, and services to help improve their quality of life, particularly with traditionally underserved communities, as well as to assist seniors with safely living independently in their homes and their communities for as long as they're able to do so. Next slide. Current state and priorities for improvement. For many seniors 65 and older, their primary means of support is Social Security. Public assistance benefits and supports are viewed as successful strategies to help older adults better navigate growing financial challenges. Unfortunately, 63,985 seniors in Chicago over 60 and also below 138% of the poverty level did not receive any public assistance benefits. And that includes public assistance income, SSI, or SNAP benefits. Relatedly, approximately 14,969 seniors age 60 years who are also below 138% of the federal poverty level are not utilizing any form of public health insurance coverage. So one segment of the older population, age 85 and older, is growing faster than the overall senior population in Chicago. So by the end of 2023, people 85 plus are expected to increase by 7% and triple by 2060. The growth among this segment of the population is expected to necessitate a corresponding increase in economic assistance, in-home assistance, and caretaker support. All right, next slide.
We're at the target population.
Yeah, okay.
Yeah.
So The target population for this particular RFP, we would like to work with older adults, 60 years and above, particularly those that are in the greatest social and economic need, those that are frail and vulnerable, as well as those with limited English proficiency. This may include subpopulations who, due to language, culture, gender, sexual orientation, ethnicity, or declining cognition, require targeted services. The program also seeks to assist seniors that may be living alone, socially isolated, or suffering from memory loss and dementia. Our program outreach will include contacting senior building managers, faith-based providers, and other senior providers to identify groups of seniors in need of assistance and support with benefits, resources, and social services. It's also important to know that not only can people, the navigators, go to the buildings, but they can also utilize community agencies like churches or libraries or senior centers to meet up with the seniors that they're trying to connect with. The target number of seniors to be served citywide in the program is 2,400 per region for a total of 9,600 seniors. Next. Okay. So the program requirements. The selected delegate agency will be responsible for program operations and management, including outreach, recruitment, assessment, program implementation, staff retention, data collection. Excuse me. The data collection will be on the impact of the program on older adults served. The Navigator providers will operate within the 4 regions of the city, serving at least 2,400 seniors per region. As part of the services and supports available, seniors may receive up to $300 in gap filling support. And the selected respondent will conduct ongoing outreach activities to ensure participation and retention in the program. Next. Once again, just wanted to give you another view of the 4 regions. This one is a little easier to read what the particular neighborhoods are than the other one. But, okay. And then the program requirements. During the entire program, the Department of Family and Support Services Senior Service Division and the Aging Well Navigator providers must communicate throughout the process and work together. We're going to recruit and identify clients for program services, determine the needs of the client and identify resources, document individual assessment and referral service plan, and make relevant referrals as a result of the interview and the benefit checkup assessments, including but not limited to DFSS Senior Services, the Illinois Department on Aging, Community Care Program, and other relevant social service supports. So enter referrals directly by emailing for service requests to the aging@cityofchicago.org and or through the Salesforce data entry. So this is one way that we expect the delegate agency will assist seniors to either put in the email for the service requests of things that they need or assist them with the data entry. Thank you. Next. So the performance goals and outcomes for this RFP. The Department of Family and Support Services seeks respondents with evidence of strong past performance against desired outcome goals. So with this RFP, we're going to look to see, will 80% of the cases show an improved knowledge of services, resources, and benefits eligibility? Will 80% also show an improved awareness of how to access and connect to services and supports? Will 80% of the cases show that the client's situation was addressed as outlined in their individual resource plan? And will 80% of the cases show improved circumstances after the case interaction? So to monitor and recognize progress, DFSS also intends to track the output metrics for the 4 designated regions that may include, but aren't limited to, we expect 2,400 clients, which would be equivalent to 2,400 units of outreach support for awareness and service support. 2,400 client resource plan assessment will be conducted. 2,400 clients will receive a benefits checkup support and introduction and review of their benefits tool. 2,000 clients will receive assistance with the benefit checkup submissions. So it's not just that they're aware of benefits checkup, but they're being helped with actually submitting. And 2,000 clients will receive referrals for and connect to DFSS programs and similar supports. And 280 units of gap filling services will be provided to 285 unduplicated individuals within each region. Next. Now I'll turn it over to Karen, I believe.
Okay, thanks, Victoria. And can you just, Tavia, can you go back to the last slide? Because these numbers to some people may look fairly daunting, but remember the city is divided into 4 regions. And so where we have, our goal for the year is to serve 9,600 individuals. That's roughly 800 per region. Okay. So I think it's important to realize that the expectation is not that every region serve 2,400 clients, but that is as a whole. Okay. So we really want to drive down that what we are looking for is having the engagement go to the communities to meet with the older adults and their loved ones where they're at. And so it's important. We will provide some outlets for that. There's many senior buildings that we know that have had a lot of older adults that are not connected to resources with. And so this is our attempt to provide support to those individuals and help them in a proactive capacity to get into the services that are available. I hope that makes sense. So just wanted to kind of go down into those numbers a little bit more so that they don't seem so daunting. Okay. And Victoria, did we describe specifically what gap filling was here in this instance, or is that later on?
No, we have not described gap filling in this instance. So go ahead.
So gap filling services are similar to what is provided to older adults through our caregiving program. They're also provided through EIS funds through the Adult Protective Services program. They're provided through ESS program, the ESS program through the Community Care program. And they're also provided gap filling services to older adults who are raising a relative or a grandchild. And the idea behind gap filling services is really that we are providing funds to meet a need that people have that is preventing them from remaining or is inhibiting their ability to remain aging independently. So this could be something like grab bars. It could be something like maybe they need new eyeglasses because they can't see things. It could be that maybe they need assistance paying for prescription medication. So there are some limitations on gap filling, which are listed in the RFP. However, really the idea is that we want to help to meet older adult needs directly where they are. And we have not in previous instances really had the opportunity, aside from the ESS program, to proactively meet these small needs that folks might have which to them may not seem small at all and may not be having a small impact on their life, but in fact, a very big one. Please go to the next slide, Tavia. And again, please put.
I've handed over remote control access to you, Karen. Can you?
Oh, I'm sorry. Sure.
No worries.
Yep. Let's see if I can get in there. There we go. Okay. Whoops, I went too far.
Up a little. Yeah.
There you go. Okay.
Oh, up again.
What we're going to talk about next is actually the criteria for selection of the candidates, the RFP applicants. So again, this is all in the RFP, but we will evaluate your applications in a variety of areas, the first of which community involvement. So we want to see that the respondent demonstrates a clear understanding of the target population, including their strengths and assets, and of course their needs and challenges. We want to see that the respondent demonstrates client and community engagement activities that will inform the service delivery. That the respondent has expertise working with the target population and has relevant capabilities and infrastructure needed to serve these individuals. So this is not a program that is done remotely. This is really a focus on getting into the community and serving individuals where they are, be it at their buildings that have a high concentration of older adults, at community service centers or senior centers, or also going out to things like faith-based organizations, block clubs, other community outlets to tap into finding people where they're at. We also want to see that the respondent demonstrates a commitment to diversity, equity, inclusion, and access, and that their leadership also engages the diverse people of the communities that they serve. Okay, whoops, sorry, I'm getting a bit excited here. All right, so organizational capacity. We'll also evaluate applications based on the respondent has qualified staff responsible for program oversight and management, that there's, of course, adequate systems and processes to support monitoring the program expenditures as well as fiscal controls, that the respondent has adequate HR capacity to hire and manage staff, that they have expertise working with the target population and relevant capabilities and or infrastructure needed to serve this group, and retain program participants, including strategies to reduce barriers to participation. That the organization reflects and engages the diverse population of the communities it serves, and that also the organization has an emergency plan to address unforeseen staffing shortages or other emergency situations. So we're going to, of course, look at the strength of the proposed program. So we want to see that the respondent is clearly defining the services to be provided directly, or of course through partnerships or linkages with other agencies. Some organizations may opt to, for example, to reach a specific audience, have a subcontract within their agreement to have another entity serve particular areas. And so we want to define the services that are provided that are appropriate to address the needs of and achieving the desired outcomes for the target population. We want to see that the proposed program is supported by a strong national or local evidence base and also or aligns with best practices in the field. We want to see that the respondent has an effective approach to identifying and retaining program participants. Pardon me, including guidance that reduces barriers to participation. We want to see a plan to effectively provide the core components contained in the RFP. So scheduling on-site appointments, identifying clients, meeting with clients, and conducting the resource assessment, sharing information, assisting with things like benefits checkup, and DFSS senior services referrals, as well as addressing refusal of services and documentation of those services provided. The respondent provides a specific plan to engage community supports that optimize the success of serving the client and provide examples of how supports will be leveraged, and then also provides a plan to address public health emergencies such as COVID-19 and other emergency contingencies that can impact older adults and continuity of services. You'll describe the policies on training, PPE, health screenings, and so on. Okay, performance management and outcomes. DFSS will evaluate applications based on if the respondent demonstrates evidence of strong past performance against desired outcome goals and performance metrics and other notable accomplishments in providing services to the target population, that there are relevant systems and processes needed to track and report performance on outcomes, that the respondent has experience using data to inform or improve their services and practices, and additionally, that there's relevant systems and processes needed to collect and store key participant and performance data. We encourage you also to ensure that you are putting your attachments in. So respondents should include best practices that are there, and evidence supports, an outreach plan, a training and implementation plan for supervision and support. The models are diverse and can be diverse in your application and can include paid, volunteer, and or in-kind professional and laypersons. The plan should also include a process for conducting assessments of older adults and impact on the evaluation plan. We want you to be sure to attach reports, studies, and other documentation that show your performance toward reaching those goals to demonstrate results and accomplishments. And also be sure to attach the resumes for key staff that are overseeing the program. I think it's also important to reiterate that anyone who is directly working with older adults and or is seeing their information, birthdays, other personal information will need to meet the criteria of DFSS background checks. So again, attach the resumes for key staff, and then also please be sure to include your organization's budget for the program and that all program requirements are addressed. Of course, we have financial criteria as well. So we want you to explain your auditing process, including if it's done by an independent auditing firm, how often it is conducted, and if this award will be included. We would like you to have fiscal capacity to implement the proposed program, including a description of how program expenditures are monitored. Whoops. Fiscal controls, excuse me, I lost my place, that are in place, and how records are maintained and stored. Also, the respondent will leverage other funds and in-kind contributions to support total program and administrative cost. So that's state, federal, foundation, corporate, and other revenue or programs can be leveraged. Finally, we want to ensure that we are that the respondent is demonstrating reasonable implementation costs and funding requests relative to the financial and human resources. The proposed budget should support the proposed scope of work or work plan.
Thank you, Karen. We
Yes.
have just a few more slides to get through, and then we'll take some questions midway through. And it looks like we have 8 questions already. So let me get to the next slide. Whoops, I don't have the slide capability. Next slide, please. All right, let's discuss the evaluation process. Applications will be evaluated on the strength of the proposal and the responsiveness to the selection criteria that Karen just went through. Failure to submit a completed proposal or respond fully to all requirements may make your submission subject to rejection. The commissioner, upon review of the recommended agencies, may reject, deny, or recommend agencies that have applied for grants based on previous performance and area of need. And DFSS reserves the right to ensure that all mandated services are available citywide and provided in a linguistically and culturally appropriate manner. The budget and cost proposals. The term of the contract for this RFP is January 1st, 2024 to December 31st, 2024. The amount of the RFP for 1 year is $265,500 per region. And we are asking that if you want to apply for more than one region, that you do so. But each region you're interested needs to be applied for separately. So just making sure that that's clear. We're not going to select where you go or what region you have. You're the one making that determination when you put in your application. The administrative cap for the Age Well Navigator and the gap filling program is 10%, and there are no match requirements for the program. Please submit the budget for 1 year or 12 months of service, and the cost category definitions are attached as budget instructions in every RFP. Okay. Be thoughtful and inclusive when developing your budget. Apply for your program's actual costs. We generally cannot give you more money than what you ask for. And use the reasonable cost question on the application to discuss how you determine the costs reflected in the budget. Next. All right. So our pre-proposal webinar, as you know, is today. We're going to answer your questions here. And then if you think about another question, you can submit that by December 8th so that all questions will be received by December 8th. And then we will send everybody the information and the answered questions to the ones that came up today during the webinar, as well as the ones that came in up until Friday. And so then everybody will be able to see the answers to all the questions. Your applications are due December 22nd. And then we hope that the program can start as close to January 1st as possible. But that's the start date for the program. Okay. Right. Next. Okay. So some of the common errors that people make with their budgets are they don't fully calculate their fringe benefits. So do show us how you're calculating fringe benefits. Also, supplies. That's often not realistic, and they can often do it under budget or over budget for the supplies. Try and think realistically what supplies you will need for this program. And then client assistance. If there's an appropriate and allowable cost, don't forget to include it. Make sure your job description titles and your job description uploads have the same title, right? And so that if you've put it in your narrative, make sure it shows that same title in your budget. Also put brief descriptions of the job in the budget document itself. And if you have not discussed it specifically in your application, please go back and make sure that it's clear. Okay, put your budget in the appropriate columns of the form and show, well, this is not really that applicable, but if you are matching, if you decide you want to do more of a match, then you have to show it in your budget document. Okay, next. And then the application are due December 22nd, once again, to reiterate. Now, keep in mind, for our system, they are done at noon, all right? And don't try and do it last minute because it can sometimes be a bit cumbersome. So the earlier you start and save, the better it'll be for, accounting for any technical difficulties you might have. All right. Now, Karen, I was hoping you and I could take some questions. The first one we have is from Judy Roca, and she wants to know what is the response time to get the home evaluation done by the Illinois Department on Aging designated agencies. In the past, families have had to wait months or sometimes not ever getting the required follow-up. So
Okay. So again, just the way that these questions work is that all questions will appear in an amendment. You'll also have the opportunity, as Victoria just said, to send in questions that you have. We'll go ahead and respond to that. However, the response time to get home evaluations for IDOA. So it sounds like, Judith, and I could be wrong, I believe you're talking about a CCU referral for a home evaluation. And families can wait months and or sometimes never either getting one or the required checkups. So it's hard to specifically speak about a CCU referral. The emphasis is going to be made on making the CCU referral, and then that we can track it internally. We may need to provide some additional guidance on this for you all, but we want to ensure that the referrals are made. Indeed, the emphasis on this RFP is getting out into the communities and connecting people with services. Okay. So what you may have to do is go back to a building at some point in the future and then follow up with those individuals that you spoke with. I also see there's a number of questions, Victoria. Let's see. So as stated earlier, our expected individuals who will be served by this program is 9,600. It is correct that there are 2,400 per region. Okay, so that's roughly 200 a month per region, 4 regions totaling up to 9,600. I apologize if I was confusing about that. So the idea is that there would be 800 monthly in all regions. Okay, so that's 800 a month or 9,600 annually, 200 per region. Regionally, the expectation would be to serve 200 per month or 2,400 per region. I think that answers a number of questions here.
right, we had several on that. Right.
Yes. So I know it's a little bit confusing, but if you back out the math, that's how it works. I also see someone asked about, are these services only for seniors residing in senior buildings or residential seniors who are renters in single family homes, 2 flats, 3 flats, etc. I think that the vision is that services would be brought out to the community to buildings that have large concentrations of older adults, so that you're able to engage in buildings that have a lot of older adults living there. And you also can go out to other community outlets, as stated. Churches.
Also, I'm sorry, Karen. The gap filling services are not specific to people that are living in larger complexes. That one is throughout the community, the region that they're serving.
Right. And certainly if you were going out to community outlets, senior centers, faith-based organizations, and others, you may in fact meet with older adults who are renters in single family homes or who own their own homes, 2 flats or 3 flats. Now, there are some guidance and guidelines as far as how things like grab bars may be put up in rental units. So we would need to probably have some discussion about that specifically. But I do see that the question is specifically about renters.
Judy
Go
also
ahead.
had another question regarding the initiative's collaboration with the state's rollout of PACE and service to support those that would otherwise go to a nursing home, not the transportation services. That will be starting up in some of the south and west side zip codes in June of 2024.
Well, we certainly share the excitement about the Program for All-Inclusive Care of the Elderly, or PACE, that is beginning to support older adults throughout the city of Chicago. Asking how this initiative should collaborate, that is up to the individual respondents. So, for example, the guidance here is that we want to engage in buildings with a high concentration of older adults, as well as community outlets that could be tapped into to engage with older adults. The purpose is not just for programs that seek to serve the medical and social needs of older adults, but also on things like Medicare savings programs, supporting people with gap filling, connecting them to getting needed technical IT devices or tablets, getting them resources for food insecurity, connecting them to home delivered meals or other resources. So this is more expansive than just one particular program, and how the collaborations start or continue is really up to the design of the individual applicants.
And it's also client driven. So what the client's interests are, there's nothing preventing people from helping them with any type of PACE applications, but it's really up to the client too. Okay, let's see.
I see a question about the applicants need to identify the housing partner site.
Correct.
Let's go ahead and tackle that one. So through our programs, visiting isolated older adults in the community, we have identified a range of buildings that there seem to be either no social services for older adults and or the significant reports of issues where older adults are impacted. We will provide a list to the delegate agencies for incorporation into their own plan. We also know that once word gets out of this to other aldermen, other public officials, we suspect that they will want their buildings tapped into as well. Everybody's going to be very excited about getting programs out to older adults where they live. So I think it's yes and.
Is there a cap for the number of community-based organizations that apply per region?
No, there is not.
Okay.
I see also another question about if a match is not required, how do you plan to consider the use of leveraged other resources of funds in the proposal? And well, that is of course assessed by our scoring protocol, which is detailed at length in the RFP. So a match is not required for many programs within aging. There is a specific match that is required. Since we are not requiring a match, programs may be, if they are able to use existing programs that they have to leverage the impact of funds in their area, they would elucidate that within their application and their budget. But that's kind of technically part of the scoring.
Right. And then there's a question, is this RFP new to the city? Yes, it is. It's a new program. Is there an estimate available as to how many individuals need to be, I believe the word they want is screened in each region out of the total that need to be served? So uh, we do expect them to reach 2,400 clients per region, and then to assist and make sure that there's follow-up, that at least 2,000 people are also having a connection with benefits.
Is that everything?
Now I'm just looking to
There,
see, there are a few more. I asked that because a gap service this grant can provide would be greatly. Also, there was an earlier question about whether the program was for, what were the requirements of the program, that it be people 60 and older, and would undocumented people also be eligible?
I'm sorry, can you repeat the question, please?
Yeah, wanted to know what the criteria were, so that people do need to be 60 years of age or older. But part of the question also asked whether we're including anyone who's undocumented or who lives in Chicago seasonally.
So we'll have to look into our Older Americans Act requirements. This program is funded through the Older Americans Act and through our American Rescue Plan Act funding. There are some guidelines on that. So we'll provide guidance on that in our amendment that will be released.
Okay. When do we expect to notify applicants that have been selected? That would be in January. Do we need to incorporate them into our plans prior to application? I don't understand the them that they're referring to. Great. Do we need to incorporate them into our plans prior to application?
Yeah, Bonnie, can you just provide a little bit more description about that? I don't want to say what I think the question is, if you can just spell it out a little bit more. So is there an estimate available as to how many individuals need to be served in each region out of the total that need to be served? Is that the question you didn't fully understand, Victoria?
Bonnie, I'm gonna unmute you so you can clarify instead of asking another question. One moment. Okay, Bonnie, you're off mute.
Hi, thank you so much. I'm sorry for not being clear. Can you hear me?
Sure.
Thank you. Karen, you mentioned the list of housing providers identified with a lack of social service programming that you'd provide to us for consideration. I was wondering if that would be provided like soon, and we would want to have partnership development kind of conversations with them prior to application, or if you're anticipating that would come kind of in January as well. Thank you.
Yep. Thank you, Bonnie, for your question. Good question. I believe that we would provide that in January. We would pull from our information. So I don't think, let's go ahead and we can talk about that at DFSS and issue some guidance around. That's a great question. Thank you for asking.
Okay.
Okay, and I'm going to recommend that we type some of the answers in to answer via the Q&A, and then we'll open the questions back up at the end of the webinar for you all to get a chance to get clarification. I'll also open the chat up in case there's any clarification needed on any of your questions.
Sure, I'll address some of the ones that can be kind of easily addressed, Tavia. Thank you for moving us along.
Sure.
Thanks, Tavia. Actually, now if you could proceed with the details, let's see.
Yeah, I'll take it over for the all the technical stuff. So
great.
thank
So-
you, Karen, and Dr. Rousseau. I'm sorry, were you going to say something?
Oh, I just thought maybe we could cover a little bit of the application tips for them, which is basically to start early, save it often.
Right.
Right. Okay.
Yeah. So just like she said, we will recommend endlessly throughout the rest of this presentation to start early and save often, because oftentimes we run into issues at the end of your or closer to the deadline where technical issues come into play, and you want to give yourself enough buffer to be able to save a successful application. So if you're new to doing business with the city of Chicago, in order to get registered, you'll need um, a specific subset of documentation that I'll go over in a slide ahead. But you'll need to register an iSupplier and eProcurement, and then once doing so, you'll go ahead and select the quote number or the solicitation number for this particular RFP. And then it'll give you access to review all the attachments that are connected. That'll be the full RFP document, a budget template, which is in the form of an Excel sheet, and a budget instruction template for you in case you have any questions. There's also an iSupplier guide attached that will help you out with navigating through the system. For those of you who are fairly new, even if you have a seasoned experience with e-procurement, it still can get a little tricky. And when we say save often, it's really that this system doesn't like the back button. So it's really important that in order to navigate out of something, you save the draft. So not to lose any information you put in so far. With that, you'll have a 4,000 character limit for each question. Most people do not meet that, but it's there for your awareness. Some tips for working in e-procurement. If you want to submit applications, multiple applications, that is allowed for this particular RFP, but you will need to create a unique email address and a separate user if you want to submit a separate proposal. If you and a partner are working on the same RFP under the same organization for one, multiple users can look at one particular quote, but to create a separate quote, for instance, for a separate region, you would need to create a separate account. Again, that due date is December 22nd at noon, and no late applications will be accepted. I know most, it's kind of standard for the deadline to be at noon or the end of the day, like 5 p.m. But this is unique in that it's noon is the cutoff time, and there at 12:01, the system will close, and absolutely under no circumstances are late applications accepted. So take that into consideration. Also, just avoid the rush if you can. I would recommend submitting 2 days before this RFP is set to close, because if you run into any technical issues or anything, you can reach out to either myself or anybody on the program team or any one of our data helpline people to get technical assistance prior to submitting your application. So and I'll put my information and Karen and Victoria's information at the end of this presentation, but for your reference, 744-HELP is the data helpline here for e-procurement, and they can assist with any technical questions about the system Monday through Friday, 9 to 5. Again, save often, submit early. Once again. Here are the requirements for anybody new that's signing up. And even to just create an account in iSupplier, you would need your articles of incorporation, the IRS affirmation letter, your DUNS number, your CCR registration, and also your certificate of good standing. And in addition to those numbers, you will need the documentation of those things added to your account prior to you having access to the solicitation or this RFP. Again, here are some resources for you to get technical assistance. As I stated before, you can call the helpline. And here is also a link available to you for any training or skills gaps that you have in regards to the iSupplier system. And all of these slides and this webinar will be available. It's being recorded. We'll be sure to post those on the DFSS website and the DFSS YouTube channel, along with a PDF copy of these slides for you to have for your reference. It can take a little bit of time, hopefully no more than 48 hours, but just to keep checking back on the website for these resources, because we'll put them up there for you to reference as you go through filling out your application. Okay, so to start, I'm going to walk us through how to accept an amendment. And as stated earlier, the questions that are asked on the webinar will be compiled into an amendment that'll be attached to the RFP. And by that token, you'll need to accept this amendment prior to having the ability to submit your application. So step one is to create your quote. And then you'll need to add the solicitation number in for this particular quote. And it'll give you a warning sign and let you know that an amendment is available for this particular RFP, and you'll need to review it and agree to its terms prior to proceeding. That info or that error message would appear here. It won't allow you to do anything prior to that. You won't be able to advance, you won't be able to submit unless you review the amendment. Once you're in the screen to review the amendment, it'll again have the solicitation number here on the top left. And in order to view the changes, you're going to click the pair of eyeglasses here in the corner. Once you've reviewed and read what's been updated, you're going to hit acknowledge amendment. And then there'll be another screen that admonishes you to accept the terms and conditions similar to any website interface that you engage with. And then you'll acknowledge here on the top left, on the top right, excuse me. And then once doing so, you'll need to click yes to confirm. And then again, you'll need to click on another checkbox that says you've read the terms and conditions. And we put all of these in place just to make sure it's thorough. But once you've checked, you've read and accepted the terms, you can hit accept here in the top right. And that's the final step of acknowledging an amendment or a change to an RFP. And with that, any changes that come after, in the instance that you submit a successful RFP and an amendment comes after you've submitted, you also will need to go back in, acknowledge the amendment, hit accept, and then resubmit your application. Just bear that in mind as well. Okay, now I'm going to walk us through the steps of how to submit an actual application. So when you're ready to submit and you've accepted all of the amendments, you can start by saving your draft. And that was the button I referenced earlier. That'll be your best friend, not the back button, this button here on the top right. If you want to navigate out of anything or make any changes, it's best to save what you have and then make those changes. Once you've done so, you can click continue. And if you have any error message, like the one shown here, all of that will read in the top left with this red signifier here. And it'll give you details on what you're missing, and you will need to update that prior to proceeding. It's usually directed to something that's left undone. In this example, it's the quote lines. And then the most common one is the value it has not been submitted. So in this example, someone didn't put their first name, and so the quote value box at the bottom will need to be satiated in order to proceed. So just enter your name in this box, and it's telling you that it's a requirement and we need that information filled prior to you submitting your application, or you won't be able to advance forward. Once your application is free from errors, you're ready to proceed, and you can click continue on your application, and it'll lead you to the review and submit phase. That is the screen, and I really encourage you to take a real fine-tooth comb to this section, specifically under requirements, because once you hit submit, there's no going back from your application being a draft. If you want to make any changes, you would need to archive what you've submitted and create an entirely new quote and submit all the information over again. So this is a really important page for you to take into consideration, and just read through all of the quote values or the answers that you've added, just to make sure that everything is in line with what you want to submit. And then once you are satisfied with your answers, there's an electronic signature box at the bottom left. Just be sure to fill that in with your name and title. And then you'll have the option to submit on the bottom right. After that, you should receive a confirmation with your quote number. For the solicitation number for the RFP, you'll see the name of the RFP in parentheses, and it'll let you know that it's been submitted successfully. And that is how to get through iSupplier. I'm going to open the chat back up for questions in case you all have them. The chat is open. Also, the Q&A portion is open. So feel free to ask any more questions, and I'm going to hand it back over to Karen and Dr. Rousseau to answer the remaining questions in the Q&A section. Thank you.
Thank you, Tavia. Okay, let's see if we have any more questions.
Victoria, I think I saw a question that I responded to in
Okay.
typing, asking how many applicants will be awarded per region. And there will be one applicant awarded per region. People can apply for multiple regions, but you need to submit different, you need to submit specific, indicate what regions you're applying for. We'll provide additional guidance to that in the amendment.
Right. And there's no limitation as to how many community agencies can apply per region, but there will only be one award per region. We have one question. Is the RFP related to the Illinois Department on Aging, or are they different programs? Different programs, but the RFP is receiving funding from the Illinois Department on Aging. Okay. And here's a question. Besides the performance measures, 80% outcome goals, are there any retention goals related to the model? For example, the number of older adults who remain engaged in programming, referral, etc., after the initial assessment and benefits screening. No, we mainly want to inform people about the services that they may be eligible for, but once again, it is pretty much driven by the client to what they are comfortable applying for and what they want to continue with when they are receiving services. The main idea is that many people don't know what they're eligible for or don't consider that they might possibly be able to apply for this particular benefit. So by walking them through the benefit screening tool and informing them about both the Department of Family and Support Service programs, as well as other community resources that they can select what ones they're interested in, what they think would help them, and then they may need extra assistance actually following through and doing the applications, especially if they're not that comfortable using computers, since so much is computerized these days. They may need somebody to help walk them through. And we're hoping that the barriers can be reduced for people applying for these services. So the easier we make it for them, the better.
So we can provide additional guidance on that in the amendment, which will be forthcoming also. And I see that Mr. Claude was looking for buildings and residents who are eligible per region. We can provide additional guidance on that in the amendment.
As well as working like the buildings within their area that we had
And
one
again,
person ask, that we'll describe more in the amendment.
Yep, that information is publicly available as well. And so we'd encourage you to dig into the regions.
Okay.
Again, those are in the RFP, and the maps are visible on the PowerPoint presentation. We will attach the maps with the RFP, but the community organizations are listed.
Okay. Anyone we didn't get to right now, if you wrote it in the Q&A section, will definitely be included in the amendments.
Great.
All right.
So with that, here are the contact you can reference if you have any additional questions after the amendment is posted. For any program questions, you can reach out to Dr. Victoria Rousseau at the number and email listed below. Any iSupplier or e-procurement questions, I'm happy to field and answer. And if I'm not available, feel free to reach out to the e-procurement hotline Monday through Friday, 9 to 5. At the number listed here, it's 312-744-HELP, if that is helpful to remember. Other than that, thank you for attending, everyone. I hope you have a great rest of your day and week. And Victoria and Karen, if you have any closing comments, feel free.
No, thank you. I look forward to hearing from anybody that might have questions on the RFP, specifically the program questions.
Thank you, everyone.
Great. Thank you. Bye, everyone.